Let's talk in this video about management of postoperative pain. It's well described in the literature that management of postoperative pain is best done with a multimodal approach, which basically means using a combination of things which minimizes risk and maximizes efficacy or effectiveness. The foundation of musculoskeletal health and the foundation of management of postoperative pain is built on community, activity, and nutrition. Having a good social support group, working with a provider team, we send nurses to the home and physical therapists. We work with excellent nursing care in the hospital. This can help rally around you to give you that support. Mindful movement is a really important part of your activity after surgery. Restoring blood flow to the tissues, keeping the body moving can really help manage and control postoperative pain. Nutrition is also paramount. Next level in the pyramid here is Tylenol and non-steroidal anti-inflammatories. We like Tylenol because it has a low risk. It's not sedating. It doesn't cause constipation. Patients will say, well, Tylenol doesn't work for me, or it doesn't make a difference. Well, even if it made a small difference, I think it's worth having some Tylenol in the system to help. NSAIDs, we typically use Toradol IV and Celebrex, which is oral, as an NSAID. Other NSAIDs include diclofenac, Mobic, ibuprofen. NSAIDs have an anti-inflammatory response, and they're not sedating, and they're effective. There's literature that shows that Tylenol and NSAIDs taken together are as effective in controlling pain in the short term as narcotics are. Next level, we would do muscle relaxant or a gabapentinoid. I don't like to use them together because they're both sedating, but we use them usually one or the other. Muscle relaxants are really good in the postoperative period because a lot of the pain is related to muscle spasm. So using, in addition to ice and movement, the muscle relaxant to help control the spasm is really good. When patients have more of a radicular pattern of pain, maybe the nerve's still irritated after surgery and we've ruled out pinching of the nerve or a blood clot on the nerve, and it's just an irritated nerve, we may discontinue the muscle relaxant and go with a medication like Lyrica. I don't love Lyrica and gabapentin because they cause sedation. They can affect your thinking, and they can cause weight gain. The muscle relaxant is probably a little better tolerated. However, it's shown in the literature that the effect on the muscle spasm is short term. After you've been taking the muscle relaxant for more than maybe a week or two, it's probably just making you drowsy as opposed to really helping with the muscle spasm. Finally, narcotics. We want to use narcotics for the shortest period of time with the smallest effective dose. There's lots of good literature that suggests that if patients take narcotics for after surgery for longer than one prescription, they're more likely to be on them at 1 year. So we want to just use them for a short period of time. They have the side effects of sedation, nausea and vomiting, constipation, and then the possibility of being on them long term. However, they are very effective for nociceptive pain, which is pain related to an injury, and surgery obviously is a type of injury. I think that with a multimodal approach, some preoperative planning and preparation, and the right mindset, pain control after surgery can be effective, and we can keep people engaged in their activities and through the surgical process with excellent outcomes.